Hi, folks. Welcome to Medicare School Daily. Glad to have you today. Looking forward to answer your questions. Just a couple things that I want to go through. First off, we are going to be, this particular program is going to have its own YouTube channel. And if you'd like to subscribe to that, you can go to MedicareSchoolDaily.com. I know several of you are coming in on different platforms right now, but eventually this will be the platform we'll be using. And so we'd love for you to get all that set up so that when we make that transition here in a couple weeks, you'll be prepared for that. So MedicareSchoolDaily.com. We today are going to look at really a very interesting topic as it relates to AI and some things that are revolving around Medicare. I'm going to teach you about that. And so AI, of course, is impacting every industry and, of course, all of us as people as well. And so we'll talk about that. And then I will take your questions. Let me give you the call-in line because we'd love to hear from you today. The number you need to call in is 833-824-2004. 833-824-2004, and we'd like to take your questions. Anything about Medicare, anything about Social Security. If you're curious about something or have a question about your particular situation, we've been doing this Medicare. Well, I've been in the insurance business 17 years, but started Medicare 15 years ago. So we have seen a lot, and so usually we can give you some good direction, some good advice to make sure that you're making a great decisions. My son and I started this company 17 years ago, and we decided that we were going to do some things differently, and that is we wanted to not be in the business just to go chase commissions. We wanted to really help people to make sure that people understood what they were doing. And so that's the educational platform of our business. We do a lot of live workshops. Of course, we have a lot of content that will be on YouTube. And so our point is we want to make sure that everyone really understands what you're doing, especially with Medicare and Social Security, because those decisions oftentimes cannot be reversed. You're going to have to stick with those decisions. You have to live with the consequences of them. And we just want to make sure that you're making the right one so that you'll be pleased with those decisions as it relates to the very important topics of Medicare and Social Security. Okay, so we'll take those questions today. And so what I want to do, we're going to go to our first caller. And then after that, then I'm going to address this issue about AI and what it's doing right now with Medicare. Welcome to Medicare School Daily. Thanks for calling in today. Who am I speaking with, and where are you calling us from?
Hey, guys. Thanks for having me. I'm Pat from Chicago.
All right, Pat from Chicago. Nice to meet you, sir. Glad you called today. What questions do you have?
So I'm 64, and my Medicare A and B go into effect on June 1st, and I'm determined that I'm going to do a Plan G. And I know that if you get a Plan G, you kind of have it for life if you can't pass underwriting in the future. So pricing is important. And I'm looking at Cigna, which is about $50 less than Blue Cross and Blue Shield and United Healthcare, but they also have a very small market share in Illinois. And that kind of worries me from a pricing standpoint in the future because of maybe a lower risk pool. Price increases in the future may not get the headlines that a bigger company gets. So, the government or the press may not really try to stop it and things like that. So I didn't know what you thought in terms of risk of going with a company that has a small market share for your supplement plan. Okay. Well, first off,
as far as the data that you're looking at, what do you have? What are they saying right now, wherever you've gone, as it relates to market share for UHC and Blue Cross Blue Shield? Can you share that with me?
So I just did it on Google AI, and it said that Blue Cross Blue Shield is about 50%, and then United Healthcare, I think, is maybe around 15 to 20, and then what's the next one? Mutual of Omaha and Aetna. So Cigna is there, but they're not even above 3% because they stopped listing it. So
okay. I'm just wondering if that has to do with, Cigna was bought about a year ago by Healthcare Service Corporation. And so I'm just wondering if maybe that would be a new block of business, because normally across the board, Cigna does have a pretty good market share. Of course, well-known company. Their prices are usually very competitive. So I'm just wondering if that would be it. I mean, I'm personally on Cigna. Of course, I live in Missouri. But I think what you're thinking is definitely true. Market share matters because the more policyholders, the risk is spread out, to more people. So I like that. And so if you're uncomfortable with it, I understand that. I guess if I were in your shoes, I know Cigna well enough to know that I think they will continue to grow in market share. So I have them, but I do know that when Healthcare Service Corporation bought them, some things did change, and it could have been a new block of business that was opened up, and maybe that's why it's so small right now. And I'm happy to have our team. I can't do that, on our program today, but I'd be happy to have our team look into that if you would like us to. I don't mind at all. And then Daniel, can we follow up with him after the show? Is it possible? Okay.
Oh, you know what? I actually talked to Kimberly, and Cigna wasn't really on my radar, and she put it on there.
Yes.
And they are $50 cheaper than Blue Cross Blue Shield. So that's kind of a big deal.
Yeah.
But that's where I just got a little nervous, when they're smaller. But maybe they're really not smaller, as you just said.
Yeah, I think that I believe what I just shared with you would be the issue. I will tell you this. Of course, I've been doing it a long time. I would say all the carriers that you mentioned, UHC, Blue Cross Blue Shield, Cigna, Mutual of Omaha, I think those are all fine companies. They would service you well. Of course, if you're our client, we service you anyways. But I don't think there's any difference there whatsoever. So I think any of those would be good as far as you'd be pleased with. If you needed something, they're not going to fight you on claims. They pay quickly. So all that is good. And so I think it does boil down to the rate stability. So from a Cigna standpoint, we have lots of clients with them. And I can tell you it's very what we call sticky business, that people just stay with them. They just usually do not cancel off of them. Blue Cross Blue Shield is strong in Illinois. I think a lot of that has to do because they have a lot of groups in Illinois, so people are comfortable with them. They come off and they'll stick with Blue Cross Blue Shield. But there's still that block is still going to be a regional block because I think Blue Cross has, if I'm not mistaken, 37 different regional type offices around the country. So they operate a little bit differently. Where Cigna is going to be definitely nationwide. So I'm assuming that Blue Cross Blue Shield is it of Illinois?
Yes.
Okay.
Yes.
Okay. That's not, and you said that your ChatGPT said 50% of the market.
Yeah.
Okay.
It was 49. Blue Cross and Blue Shield, 48.2%.
Okay. Well, that's sizable for sure. We usually don't see someone dominating the market like that. So that's good. So I would say, if you decide you want to go with them, but for me, I like Cigna. I think $50 is significant. You're definitely, you're in a attained age state, so we know those are going to go up. All of them will every year, a little bit because of, you're going to be a year older. So I wish I could give you more, but I'm happy to have Kimberly. Did she give you those particular numbers as well? Did she confirm that?
Yeah, well, we didn't talk about market share, but she gave me the numbers, and the $50 is really great. It's really nice. Yeah. So I'm definitely leaning towards them, but I just was curious about what you thought when you have one player that's so big.
Yes, sir.
If they have a price increase, the government gets involved, but who knows with a small company. Right,
yeah. Actually, honestly, when you said that amount of market share, I thought, wow, how could that be so? I've just never seen a company have that sizable of a market share, but it could be true. So I wish I could help you more, Pat. Anything else that you want to talk about, sir?
No, but you did help me, and I really appreciate you taking the time. Thank you.
All right. Well, great to talk with you. We'll see you. Thank you.
Take care then.
Yeah, you too, sir. Bye. All right, just before we get to our next caller, I want to address this topic that we told you we'd talk about today that has to do with AI. And I kind of want to preface things here just to kind of lay the foundation so that everyone knows why we're talking about this particular topic today. Right now, when we look at the health insurance business, there's always been four key players, and those players would be the patient, would be the provider, that would be your doctors and hospitals and pharmacies. Then you would have the payer, that's the one that's going to certainly pay the bill, and now we're talking about the insurance company as well as Medicare. And then you had policymakers, and this would be the federal government setting the rules and determining how these plans should function. So we have patient, we have provider, we have payers, and we have policymakers. Well, this particular issue, we're going to add another player to it, and that would be pharma, big pharma. Because this issue that we'll discuss today is all about specialty medications. And so specialty medications are those medications that are usually very expensive, that have to deal with not just cancer, but things that are real serious like cancer. They're very costly. And so what happens when someone enrolls into a drug plan, whether that drug plan is a standalone drug plan because they have a Medicare supplemental plan or it's embedded within the Advantage plan, that Part D plan is going to provide the patient a formulary. That's the medications that are going to be covered. And all the meds that are going to be expensive are going to be rated as a specialty medication. And I'm talking meds that are anywhere from probably $30,000 to $150,000 a month. And those meds can be covered, but because they're specialty medications, there will be a pre-authorization process that has to go through the process in order for that medication to be filled. So it's called pre-authorization. And rest assured, if it's going to be expensive, we're going to have to do this. And so what happens is, in order for a patient to be able to get that specialty medication, the doctor has to provide justification for the medication, usually provide some type of medical records to give that to the insurance company for them to approve that. So then they have to review the paperwork that comes to them. And so there's both parties involved. Patient needs it. Doc wants to get it filled as quickly as possible, but has to justify why it is they need the medication. And then the insurance company is going to go through all that paperwork and then make the final decision. So the point is, there's a lot of work involved. It takes time. I read recently where the average doctor spends about 13 hours a week just on prior authorizations for these type of medications. And so the fix on this, as far as artificial intelligence is concerned, there is companies that are now, what they'll do is they'll provide through AI an opportunity for a doctor to be able to expedite this process, to be able to go through the medical records very quickly and then supply the information to the insurance company. And so there could be additional lab work that's involved. And so if we have a human behind this, it's a very lengthy process. And then from the insurance side, same thing happens. Again, humans involved, making sure all this is very necessary. So AI right now, one of the fixes would be to the doctor to be able to gather those records quickly, lab works quickly, and then in very short order get that over to the insurance company. And so that's where the artificial intelligence has been very helpful for doctors. Now, docs have been using AI now for a while. It allows them to do very quick research. It allows them to expedite, the information that they give in their system about their patients. So docs are certainly, they're not new to AI, but this is a new aspect. So now companies are saying, okay, we will help you do this. And the whole issue is to make sure people get their medications very quickly. And so the specialty pharmacies love this because now they have the information, and again, they can use the AI tool to make sure that they see that this is justifiable, that the insurance company should pay this claim, provide this particular medication. All right, so that's what it's all about. So we're excited about this. I don't think the whole system is perfected yet, but I will tell you that I think there's 40 or so large hospitals that are now using this AI tool, actually developed by a couple young guys. And I think they've got an excellent piece of equipment now that can be used to help people get the meds faster, expedite that process. I read a report from actually a lady who owned a specialty pharmacist, and she said it takes a lot of time for them to do this, and so they too are using this tool. She said there's no way to hire enough people and to get the information fast enough, but AI is solving that particular problem. All right, and now when it comes to AI, I know people have different opinions. I can tell you that I do a lot of research for our content, and so I find that usually they're accurate, sometimes not, but I think it is a very good tool. So I think more and more we're going to see AI being used in the medical field for sure. My understanding is the insurance companies counties are not on board with this particular aspect yet, but I think that will be forthcoming so that those two systems then can interact with one another and expedite that process and get people the medications that they need. Because the issue is you don't want it to be delayed, and so with the AI being much faster, then there should be less delay, so people can get those medications that could be life-saving. Okay, let's jump back on the phones, and we'll get to our next caller. Hello there, and welcome to Medicare School Daily. Glad you called today. Who am I speaking with, and where are you calling from?
Hi, Marvin. This is Paul. I'm calling from the Atlanta area of Georgia. I'm actually a Medicare School client.
Okay, Paul. Well, thanks for allowing us to serve as your broker. Appreciate you calling as well. What's on your heart today, sir?
It's about IRMA. So I retired over a year ago, and I had to do an IRMA appeal, which I did successfully, and just got another appeal that went through for me successfully.
Good.
The issue is my wife. She's on spousal benefit, but hers was denied. So we called the Medicare number. This was before March the 7th. And they said, oh, yeah, we've sorted it out now. She'll get a letter sorting it all out. But here we are in March, and we've got nothing. Mm-hmm. So do we just wait, or should we try calling again?
Well, I mean, you certainly can call again. If the local office said they sorted it out, I would suspect that would be true. And now, let me ask you this. Was your appeal went through, and was this the 26 IRMA? Is that what we're talking about?
Yes.
Okay, very
right.
good. All right. So she used the same life-changing event, and she used the same date that you did?
Yes, I basically submitted the same documentation.
That's good.
Package.
That's great. That's great. So what I think will happen is I think they will sort it out, and then what will happen if you actually end up having to pay it? Is she on Social Security?
Yes.
Okay. So if they deduct it out of the check, you will get that overpayment back. Sometimes it can take 6 months or so, but I have seen that happen before when the IRMA goes through, and yet the appeal, that we won it, but it was not in time, and so that money will come back to you. I've seen that several times actually. So if you
mine went through very quickly. So I did have one overpayment, but I got that back in January. So mine is all clear now. But yes, we've seen her Social Security check is down every month so far.
Yes, sir. Well, if you can call. Of course, now you're going into the main 800 number, and they'll direct calls all over the country. And I do think sometimes some people will be in this transition as they move from the local office system to more of the the national based system. So I think that was one of the concerns that they actually published, saying, hey, this could be a little bit difficult with cases that are pending. They may be a little bit slower. So you may want to give it one more month and then call in if you don't see any change on her April check. That's probably how I would handle that.
Yeah, I appreciate that. I mean, the person we spoke to, it wasn't our local office. It was another office.
Yes,
but
sir.
During the call, she confirmed the details with the local office. So sounded like it was all correct. But it worried me when I listened to your presentation about the March the 7th changes. If we had got lost in that somewhere.
Yeah. Well, you probably didn't get lost, but it may have been somewhat delayed. So yeah, let's see what happens in April when she gets her check. Hopefully by then they'll have it corrected. But I do know that they're good about it. When they charge you something, they should, and they're good about refunding that money.
Right. Okay.
All right.
Great. Well, appreciate your help.
Yeah. Well, Paul, good to talk to you. Let me, if you don't mind my asking, what kind of plan are you on? Are you on a supplemental plan?
Yes, I am. It was all set up by one of your people. So, we on the United Healthcare.
Okay.
And I'm on a WellCare plan. It's zero cost here.
That's good.
But yeah, it's been very good. I mean, last year, I did a lot of physical therapy, a lot of sessions, and as you say, just got charged the deductible, and that was it. Very pleased with it.
Very good. That's good. Well, I'm glad you're served well, and anytime, please don't ever hesitate to contact us. We'll be here for you, sir.
All right. Thank you.
Good to talk to you, Paul. Have a good day, sir.
Thank you. Bye.
Thank you. Bye. Well, welcome to the program today. We're glad you've called in. Who am I speaking with, and where are you calling us from today?
I'm from Indianapolis, Indiana. My name's Steve.
Hello, Steve. Nice to meet you, sir. Appreciate you calling in. What are your questions today?
Well, my question is, my daughter just got on Medicare. Okay. May 1st is when she gets on. And I'm trying to figure out, she's on Indiana Medicaid, and then she'll be on Medicare. So my basic question is, do I need an Advantage plan, or do I use my supplement Medicare to pay her 20% Part B plan?
Okay. Yeah. Now, you said, would you use yours, or are you asking if she could get one?
Yeah, well, she's getting her own plan. I've already got my own Medicare plan.
Okay. I understand that. I didn't quite follow your question. So, because she is on Medicare and Medicaid, she would be eligible for what is called a dual eligible Medicare Advantage plan. When you're on Medicaid, you cannot legally buy a supplemental plan because the federal government as well as the state government are covering your expenses. So they're saying if you can afford a sup plan, then we're not going to help you out with your Part B and other costs. So she would be able to get a Medicare Advantage plan, and so that if it's something that you would like to talk about, you can call us or call someone that writes those plans. We write them, but they are called dual eligibles, and they are designed specifically for people on Medicare, Medicaid, and frankly, they have some pretty good benefits to them. But one of the keys for her, of course, we'd want to check doctors and medications and all that. But those should be available in the state of Indiana. Most states have them, dual eligible plans. Hey, Steve, do you happen to have our number if you decide to call in? Do you have it handy? I can give it to you if not.
Yeah.
Oh.
Yes,
Okay.
I've been through with several people so far.
Okay.
One applied for my daughter back in February, and she was denied for dual, but they said that she didn't have Medicaid or couldn't find her Medicaid number.
Right.
The second person put her in the G plan, and then I heard you say that was illegal, so I called them back and told them I need to get her canceled out of the G plan because she was accepted for that.
Okay. Yeah.
And so I'm just running. I don't know if I really need to do you actually need Advantage plan?
Okay.
Because Medicaid picks up all the secondary stuff.
Okay, you don't have to. I think the reason that some people will do that is because of some of the perks that they feel like they can take advantage of that's offered by the Advantage plan. And so if those are not if those are unimportant, I know most of them have over-the-counter cards. Most of them are going to, especially with Medicaid, there may be some additional money available for extra things. I don't know if she would, use the gym membership, those kinds of things. So that would be the reason people do that, but you don't have to do that at all. I definitely would at least look to see if you think those would be beneficial. But Medicaid will coordinate with A and B, or Medicaid will also coordinate, of course, with with the Advantage plan. Either way. I don't want you to think that you have to do that. I would just tell you that most people do it because, you've got normally some pretty good dental benefit with the Medicare Advantage plans that you're not going to have available just through Medicaid by itself. Transportation probably would not be an issue for her, but some people do it for that reason. So, and I'm really sorry that someone put you on that, put her on a G plan. They certainly didn't ask enough questions. So, yeah.
And so another question that I have with the if there's the doctors that they originally put her on, that she uses about 7 specialists. 6 of them are on the Advantage plan that they originally tried to get her on. One doctor was not. So would that one doctor that is not on it, would Medicaid pick up that doctor payment?
Yeah. Well, I tell you, I don't think so. And the reason for that is because Medicare pays first and Medicaid pays second. And so if that doctor is not contracted with that plan, I don't believe so. I think now what could happen. Go ahead. I'm sorry.
He's contracted with Medicaid though.
Okay.
Because we use him now on my private insurance for my wife and my daughter.
Okay. Hey, Steve.
So when she goes to that doctor, yes.
Yeah, would you do me a favor? Why don't you call and talk to someone in the billing department?
Okay.
I think that would be very safe to do so, because I don't want to tell you something that's incorrect. I do know that those definitely are all network plans. But and see, what happens is this. When you go to a doctor on an Advantage plan, unlike you, what'll happen is, Medicare is not going to be involved when someone enrolls into an Advantage plan. They're not going to pay any individual bills. And so that would be my concern. Since Medicare is not going to pay, then that portion that they would pay may be on you. So that'd be my concern. The other issue could be here now. Was it a PPO plan or an HMO plan that worked for her? Do you remember?
I think it was a PPO plan.
Okay,
They tried to get it on.
Okay, well then if it is a PPO plan, then she can go out of the network as long as the doctors do take Medicare. So that doc would be covered then. It may be a little bit more expensive, but I think Medicaid then will pick up that higher copay. I do. Okay. Yeah. So I should ask you that. But on PPO plans, you have the right to go out of network. You just have a little bit more out of pocket. But I think Medicaid will pick that up. So I think you should be fine with that, doc, as well, if it's a PPO plan.
Okay.
Okay. Yeah.
Okay. Thank you very much, sir.
All right. Well, thanks for calling in. Good to talk to you today.
Okay.
We'll see you. Bye. Well, welcome to Medicare School Daily. Thanks so much for calling in. Who am I speaking with today?
Hello, my name is Jackie.
Hi, Jackie. Thanks for calling. We are excited to have you on the program. Where are you calling us from, Jackie?
I live in Mechanicsville, Virginia.
In Virginia. Okay, very good. All right. So what would you like to discuss today?
I wanted to find out, I'm still working. I'm 67, and I would be 68 in September.
Okay.
And I already have the Medicare Part A, and I wanted to know, I have a couple of questions. Wanted to know, when is the right time to put in I want to get a Medigap plan.
Okay.
And when is the right time to put in for that if I'm going to retire October 1st or between October 1st and November 1st?
Okay, that sounds good. So let's use the October date. Okay, so September, August, and July. All right. So the timing would be any time after July 1, if indeed you're going to shoot for an October date, which is 90 days prior. If it's going to be November, then you can start anytime after August 1. And so the process involved with this would be there's two forms. And by the way, Jack, if you decide to use our company, we'd be thrilled to serve as your broker and help you. We can do all this for you. Okay, but the forms that we would be filling out for you, or if you do it on your own, there's a form called an L564, and it says request for employment information. And so let me ask you this, Jackie. Since you've turned 65, have you been with the same employer?
Yes.
Okay, so you haven't changed jobs. Okay, that sounds good. How long? So how long have you worked for that company?
For 13 years.
Okay, that sounds great. Well, that's plenty. So the L564, it has a couple sections, and Section A would be what we would fill out for you, or if you do it on your own, you fill that out, which is simple. It's your name and your Social Security number and address, those kind of things. And then you give it to your employer. HR department typically fills this out. And by the way, if your HR is not local, it's not a problem. These can actually be scanned and emailed to an HR department, and they can complete them and then scan and email them back to you. Okay, so it doesn't have to have an original wet signature. And so they're going to verify that you have been working there and that you've been covered by insurance. And of course, Medicare, Social Security only cares back to 65, but you've been there 13 years, so been there plenty. And they're going to verify that, and then they'll send that back to you. And so that's the only form the employer has to participate in. Then the second form is called a 40B, a CMS 40B. And so what that form is going to do, it's going to let Medicare know when you want to start your Medicare B benefits. And so Again, it's real simple, just basic information about you, name, address, Social Security number, your Medicare number. I'll ask you a couple questions, and then you will, on the comments section, say, please begin my Medicare effective October 1 or November 1, whenever you want to do that. So that's the two forms that we use for special enrollment periods. And so very simple. And then those would be uploaded on the site. In the old days, we would have you drop them off at an office, mail them in, but that's not the best way to go now. Those can be done online. It's a wonderful system, and those will be uploaded to Social Security, and then they will process that application. Okay, so the L564, CMS 40B are the two things that are necessary, and then these cannot be dated any sooner than 90 days prior to when you want your coverage to begin. So that's what I'm saying. If you're going to go October 1, we're good anytime after July 1, November 1, then after August. So don't do it prematurely, because if you upload those any sooner than longer than 90 days prior, then they will not process them. Okay, so that 90-day window is ideal. Okay, did all that make sense to you?
Okay. Oh, yeah,
Okay.
because I've been watching you for a while, and I knew you answered it, but then I saw somebody say something about 6 months prior, and I said, I know that wasn't right.
No,
that's
no.
far out.
Yeah, I think maybe that like
but
6
I also-
months. I was going to say, just so you're clear, there are some states where we can actually set people up their supplemental plans 6 months before effective date, and some states are 3 months. So that may have been what someone was talking about. But when it comes to this SCP paperwork, it's always that 90-day window.
Okay.
Okay.
And because I didn't take it out at 65 and I'll be 68 by that time, my premiums would be a little higher, won't they?
You're talking about your supplemental plans?
Right.
Yes, they will be, but it's not honestly substantial at all. I mean, it may be $15, $20 a month, probably at most, higher than what a 65-year-old would pay. Yeah, and of course, Part B will still be the same.
Give me an estimate.
Well,
I
am really sorry. I'm by myself today. Normally, my son and I do this together, but he was in a meeting longer, so I don't have access to that quickly. But do me a favor. Do you have our number? Because I'll give it to you right now if you don't, and you can call in. You can call right now and just ask to speak to an agent. They'll give you prices immediately. So here's the number. It is 833.
Okay.
833. Okay, 833-833-3661. 833-833-3661. Pardon me?
Okay. Oh, you say it's 833 twice?
Yep, twice. I know that's kind of odd, but it is. Yeah, 833-833-3661. And we're open, of course. Just call in and tell the reception team that you would like to speak to an agent, and they'll transfer you. And you can tell them you're on the call today and you want some rates on supplemental plans in your area. Okay, and they'll give them to you.
Okay.
If Josh was here with me, we'd do it. Well, you are welcome, Jackie.
Oh, okay.
Yeah.
I've been watching you for about 2 years now, and I know I'm going with you anyway when I get ready to sign up. So
all right. Well, hey,
no problem.
Thank you very much. I'm glad we met that way. And then also, you tell that agent that you want them to do this paperwork for you. They will. That's no problem at all. We'll help you with it. Okay?
Oh, okay.
All righty.
Yeah, I got to wait a little while. Thank you so much. You are awesome. I appreciate it.
Appreciate the encouragement. Nice to have you calling in today. Take care. See ya.
You too. Bye-bye.
Bye. I do want everyone to know that this is our business. Of course, we meet people all the time through education, but the next step is when it is time, like it is time for Jackie, of course, to go on Medicare. We would love to help you through that process. One of the good things about using us, or really anyone you use, there's no cost. The insurance companies pay us, not you. But what we try to do as a company and try to be unique is we really don't just want to sell a plan. We want to make sure that every aspect of your coverage is the right thing for you. And so we'll take the time to make sure that we look at several different Medicare supplemental companies that are in your market. We'll talk about those initial premiums, the stability of the rates, and then if you want to go with an Advantage plan, we have to go through and make sure all your docs are covered, your meds are covered well, the hospital choices you have. So to reach out to someone to be able to help you through this process. And listen, I mean, most of you watching this, you're plenty smart to do this on your own. But what happens is there are a lot of moving parts, and sometimes people are concerned that maybe they'll make a wrong decision. Anyway, so if there's that fearfulness, there really doesn't need to be. We're here to remove that fear, to help you all along the way. We'll hold your hand through this process, whether that's coming in at 65. People today, many are not even taking Social Security yet, so they have to do their own self-enrollment. So we'll help you do that. If you want to tie in Social Security at the same time, we do that as well on the application. And then for someone like Jackie, who has to do the special enrollment paperwork, we're happy to do all that for you, get that to you so that you can download it on the SSA.gov website. So point is, anything you need from A to Z, that's what we want to do. When I first got in this business, as I said, I started this company 17 years ago, started doing Medicare 15 years ago. I was determined that I was going to understand this process, that we knew what was going on so we could give honest advice and helpful. And so we don't just want to sell a plan. We want to make sure that Medicare A and B is set up correctly as well. And so be sure to utilize us in that, because we love doing it. It's very rewarding to be able to help people make these decisions at this time. And so we'd love to help you as well. So give us a call. Again, that number, if you want immediate assistance, is 833-3661. That'll call into our switchboard team, tell them what you want, and then we'll have an agent assist you. And then we'd love to hear from you still today. If you want to call in, the program number for call-in is 833-824-2004. Any questions you have about Medicare, Social Security, we'd love to hear from you today. All right, I wanted to answer a question here, actually make a comment on something that came through our Facebook group. If you want to join that, we'd love to have you be part of that. I think we're 60,000 people in there now, and a lot of great comments and really dialogue that goes among the participants in this group. And so if you want to join that, we'd love to have you. But this lady, Elena, writes, and she says, why are we constantly bombarded with calls and texts from health allowance cards of up to $3,300 Advantage card, carrot dangle game? She says, I hate this. And so this is very common today in the marketing of Medicare Advantage plans. Because what they try to do is they try to talk about things that can stir people up and get people interested. Now, I wish they would talk about how the Medicare Advantage plan is going to work, actually, but they don't. They want to talk about these added benefits that could be available. Now, one thing that everyone has to keep in mind, that just because a benefit is advertised and available doesn't mean that everyone's going to qualify for that. Many times these additional perks that really have high amounts that may interest people are only for people that qualify for Medicare and Medicaid, because there's additional money available, because of Medicaid. So you have to be aware of that. You have to be real careful. The traditional, just average Advantage plans, they're not going to have a lot of these extra perks. They'll have some, but not a whole lot. But again, these companies are great marketers. They're going to reach out to you, and they're going to emphasize these benefits so that the phone will ring, and then they do a bait and switch, because if you don't qualify or that's not available in your market, then they'll, of course, try to get you on some of the type of an Advantage plan. And again, I'm not anti-Advantage plan. We write Advantage plans in our company because sometimes it absolutely is the best fit. But I think what you as the consumer, really, I think we owe to you is to make sure you understand what you're actually getting with the insurance. Because, I can talk all day long about a gym membership and hearing aids and a dental allowance and maybe some vision allowance and some of those perks that are very nice. But I also need to make sure you're aware that when you sign up for those perks, you're also signing up for a plan that's going to have a network of doctors, HMO and PPOs. And many of them today, in fact, most of them today are going to be HMO plans. And so that means you have to stay in that network. You cannot go out. And so if you find yourself in a situation where you want to go to a certain doctor because you have cancer or, some of the health issue going on and they're not in your network, you can't go there. It just doesn't work that way. You have to stay within your network on an HMO. PPO will let you go out of the network, but it's going to cost you more money to do that. And so the whole point is perks are fine. And I hope people can take advantage of them, but please don't make a decision on your Medicare just because they're throwing in some free perks, because with that also also are going to come plans with pre-authorizations, guarantee you. At least one out of every 4 services you're going to need is going to have to be pre-approved by the insurance company. And that sometimes is delayed, sometimes is denied. And so when you give an insurance company the right to have the final say-so in your health, then that can be problematic. I've had plenty of people that needed knee replacements, but they didn't get them until after 9 months of therapy, or needed a full hip replacement. And the company says, no, you don't need that. We'll pay for a rod, and that's all we're going to cover. We know that when people go in for some type of a heart surgery, Advantage plans will not allow that doctor, they'll not cover a CAT scan prior to surgery. Original Medicare would do that. And so just be mindful that you're making a decision about the kind of medical coverage that you're going to have if you have some kind of a serious health issue. And again, companies don't want to talk about that because they're going to fall short when it comes to those type of issues with Medicare Advantage plans. Original Medicare with a supplemental plan, if someone can afford that in their budget, then they're going to get a very high quality insurance. No pre-authorizations by the insurance company, certainly no networks ever have to deal with, and lifetime plans instead of just one-year plans like we'd have on Advantage plans. But that's why, and that it's not going to change. As long as Advantage plans are around and they pay such a high commission to companies and to agents, these marketing things are going to continue on to emphasize really the things that, in my opinion, should be secondary, not primary. Having a question here from our Facebook group from Kelly. She says this: I heard if you are on Social Security at 62, they automatically sign you up for A and B coverage. Is this true? And it is true. If we're taking any form of Social Security benefits, it could be our own retirement benefits, spousal benefits, survivor benefits, widow or widower benefits. What happens is as we approach our 65th birth month, then we will be automatically enrolled into Medicare, and they mail you the Medicare A and B card. It's about it shows up about 100 days prior to birth month. So today is March, and so if we were to back up the clock, February, January, December. So if someone started their Medicare this month, they would have gotten their card towards the end of November. Always happens that we're about 100 days prior. And so people that are on Social Security right now and they're getting their cards this month, during the month of March, it's because April, May, June, that's because they are turning 65 in July. So again, 100 days prior, Medicare's card is going to show up. There's nothing you can do to stop that. Now, the issue is sometimes people really don't want to be on Medicare when the Medicare card shows up. And the reason for that is really only one, is because they or their spouse are still working and they have a great insurance at work. The plan's good, the cost is good, but Medicare card shows up. And so in those situations, what I encourage people to do, as long as the group is 20 or more employees on the payroll and it's a good group plan, then what I would do is I would disenroll from Part B. If you're on Social Security, you have to stay enrolled in A, but if you have a good group plan that's better than your Medicare option, you don't have to do B. And so the way you do that in that situation is they mailed you the card, so on the back of it, just turn it over, and it will give you the option to disenroll from Medicare B. And there's a box at the top that says, I do not want medical insurance, medical meaning Part B. So you check the box and you'll send the card back into Medicare, and then they will drop off the Part B. You don't have to pay for it now, and then they'll send you a new card that will say Medicare A only. And then when you lose that group plan, then you can come in back into Medicare at a later date. That window of time is 60 to 90 days prior to losing your group plan. Then you'll apply for Part B again, and that's called the special enrollment period. And so it's a really seamless process. The key is if you do send the card back in, you have to continue to be covered by some type of a group insurance. It has to be, it could be yours, it could be your spouse's, it doesn't matter. So that's credible coverage. And we have to prove that, of course, back to 65. So yes, everyone that's on Social Security will be automatically enrolled into Medicare A and B. Card shows up 100 days prior. If you need to go on Medicare, that's all done. Then you can make your other decisions as far as Advantage plans go, or supplemental plans, drug plans, all that. But if you have a good group plan, send the card back in, have A only. Another reason I like that is because if you do have a group of 20 or more, that means that Medicare is going to pay second anyways. So your group plan is still going to pay first. So if you kept Medicare, it's in the second payer position, and you're at least paying $202.90 a month for Part B, and it's in the second position. I personally think that's a waste of money. If you have a good group plan, send it back in and do A only.